Ultrasound physics is broken into 3 major chapters so that the information provided is bite-sized and easy to follow. This is part 3 of the lecture series where we focus on ultrasound knobs and artifacts. The knobs are the buttons you will be adjusting on your ultrasound system so that you get the best picture quality possible, and artifacts are errors that you will likely encounter. The basics of ultrasound, modes, probe types, and interactions with tissue are part 1 and 2 of this lecture series. The full lecture is also available if you would like to watch this 1-hour lecture in one go. Let's take a deeper look at the ultrasound machine and its knobs. Knobology. Depth. This setting controls the vertical depth of the field of view. We need to set depth to the target structure for optimal spatial resolution. Increasing the depth allows deeper tissue interrogation at a cost. This increased depth increases the scan time since the machine will need to wait longer to hear returning echoes from deeper structures. Both transmit and receiving time are increased. This in turn increases the time per frame, which decreases the frame rate and will lower our temporal resolution. Using a lower frequency probe may allow us to see deeper structures, but this also makes shallow structures to have a loss in resolution. Note that in the far field, the ultrasound beam diverges, which implies a worse lateral resolution. Remember that the axial resolution is mainly determined by the spatial pulse length, and a lower frequency probe will have a worse axial resolution. At an increased depth, the increased scanning time also causes a lower pulse repetition frequency, and thus it lowers the Nyquist limit, so we are more prone to aliasing. In these examples, we see the effect that increased depth has on the frame rate and the overall resolution of the image. The ultrasound display will display a distance scale. This refers to the visual representation of the distance between different structures within the scanned area, essentially acting as a ruler on the image. This distance is displayed in centimeters. This is important so you have an idea of the scale of an object and very relevant in point-of-care ultrasound since you will not be routinely making precise measurements. The ultrasound display data will typically inform you on the preset being used, the type of transducer, its frame rate, and the frequency you have selected if it is a multi-resolution probe. It will also tell you the depth of interrogation. Focused versus unfocused beam. Focus beam. With the target object in view, set the focus depth to that specific location. We see this in action in these 2 examples with the focusing beam turned on at different distances. Notice the better resolution on the second example. The ultrasound beam is forced to focus on this selected depth with the narrowest diameter at this level, the focal zone. This causes the lateral resolution to be highest at this depth at the cost of worse resolution at the deeper depth. Axial resolution may or may not improve since this is determined mainly by the pulse length. A high frequency probe with a large footprint will have the furthest near field. On the opposite end of the spectrum, a lower frequency probe with a small footprint will have the lowest near field. This implies that if you want the best lateral resolution for a given structure, you want to be able to select a probe or frequency with the biggest footprint and the highest frequency. Here we see a comparison between 2 different focal zones scanned in the same anatomical area. Sector scan size. The imaging sector is the area displayed on the ultrasound machine. This area is most commonly manipulated when using the curvilinear or cardiac probes by making it broad or narrow. Here is an example of 2 sectors with different dimensions. We can move the sector around to address an area of interest. Decreasing the scan size area improves the frame rate by using less scan lines per image and thus improves your temporal resolution. On a similar note, when using Color Flow Doppler, we need to select a small area of interest for optimal temporal resolution. It allows us to measure speeds more accurately. Gain. Gain adjusts the displayed amplitude of the returning signals, and increasing it causes an increase of all returning signals. Think of it as using a megaphone on the returning signals. It does not increase the power or energy of the ultrasound beam. For optimal settings, look at areas in the sector that should not have any physical structures, such as vessels or cavities. The gain should be increased until some returning signals are seen and then slightly decreased. Here are 2 examples. In the first, the gain has been automatically set by the system. On the second example, we have increased it significantly. With time gain compensation, the gain of the returning signals is amplified based on the depth of interest. These images are of the brachial plexus. On the right, the system has automatically set the gain. On the left, we have increased the gain on the middle distance on this 2D clip with an increase of gain compared to the rest of the structures. We can expect that at deeper structures, this feature might be turned on in a ramped up configuration. Frequency. In a multi-resolution probe, we can select between the different frequency settings that are available on the probe. We can toggle between the different frequencies of the probe or its bandwidth. We can choose between different frequency modes. We have high frequencies, general, and penetration. In these clips, we see the effect of changing from general to penetrate with a sector set to the same distance. Harmonics. As the ultrasound wave travels through tissue, the shape of the wave gets distorted. This change in the wave leads to the generation of harmonics. These are multiples of the transmitted frequencies. If we allow the probe to receive these returning waves, we may see an improved lateral and axial resolution, since the waves received are now of higher frequency. Harmonic frequency is especially useful in patients where the endocardial border is difficult to visualize. This feature may not be useful for very shallow structures, because we are already operating at high frequency. Here we see comparison clips of the harmonic function on or off. We note that turning it on defaults to the general frequency. If we compare this image to the penetration frequency mode, we can see better resolution overall. Contrast resolution. This aspect of ultrasound machine controls reflects to the ability to distinguish between different echo amplitudes of adjacent structures. We will touch base on the most common ways we can improve contrast resolution for POCUS. There are features that may not be available on portable machines. Dynamic range. The dynamic range refers to the range of amplitudes of the returning signals. The dynamic range will not change the amplitudes of the returning signal, only how the returning signal is displayed on your ultrasound display. The ultrasound machine compresses all of this information by reducing the dynamic range. We can manually change the dynamic range if we wanted to. High compression narrows the dynamic range and creates an image of high contrast. What we now see is a display with sharper, more defined edges with much higher contrast. At the other end of the spectrum, low compression widens the dynamic range and displays an image with many shades of gray. Increasing the dynamic range allows you to see very low and very high amplitude signals on the display, and thus a wide range of grayscale. Borders appear grainy or blurry. Chroma maps. Contrast resolution may be enhanced by changing the chroma map of the display, so it may be easier to distinguish between shades of color instead of shades of gray. Artifacts are any perceived distortion, errors, or misleading images created during ultrasound signal processing. Failing to recognize an artifact exists may make you believe you see something on the display when it actually does not exist. Here, we review the most common artifacts you will encounter in your POCUS journey. The way to troubleshoot this typically involves changing the angle of your ultrasound probe and interrogating the area of interest on multiple views. It is important to note that the only organ system where you want to see artifacts is that of the lung. We'll review this topic in detail with the lung ultrasound lecture. Reverberation artifacts. Reverberations are formed when sound wave bounces between two strong specular reflectors, which are reflectors that are at 90 degrees to the ultrasound beam. These strong reflectors cause the ultrasound beam to bounce back and forth between them. Once this reverberated ultrasound beam comes back to the machine, it interprets an image as if it's coming from deeper structures since it took longer to get back to the transducer. The echoes that appear at increased depths do not correspond to any anatomic structure. Think of the ultrasound beam as partially trapped between them and only returning at a later time. The result is of equally spaced images beyond the actual structure of interest. To eliminate this effect, attempt tilting the transducer so that the reflective structure is no longer at 90 degrees to the ultrasound beam by altering the angle of incidence between the beam and the structure. Example of reverberation artifacts can be seen when examining the lung. The pleural line. In the display, we see multiple equally displayed echoes creating equally displayed hyperechoic A-lines representing reverberations of the pleural line. The blue arrows denote the direction of the ultrasound beam. Notice that the beam reflects back but is trapped at the pleural line, causing a delay in the returning signal to the probe. Another example is comet-tail artifacts. Comet-tail artifacts are also known as B lines. These are artifacts that originate from the pleural line and appear hyperechoic and extend indefinitely, erasing A lines and moving in concert with lung sliding. Acoustic shadowing. When a structure reflects off most of the ultrasound beam, that structure is typically bone, calcium, or metal. This casts a shadow on the structures that lie deeper. Shadows appear hypoechoic or anechoic, and you would not be able to see any structure deeper than the barrier that reflects the ultrasound beam. These are artifacts that is common when evaluating in between rib spaces. Here are two examples of acoustic shadowing. When scanning the lung, air has a greater attenuation coefficient than that of bone and creates dropout shadows on the deeper structures that lie beyond. This is the reason it may be challenging to evaluate the lung in patients who have subcutaneous emphysema. In a patient with a full stomach, the air trapped in the stomach creates an acoustic shadow of the deeper structures. Also, rib shadows on the right upper quadrant creates hypoechoic regions and dropouts of the liver. Acoustic enhancement. Acoustic enhancement occurs when the ultrasound energy passes relatively unattenuated throughout the medium with a low attenuation coefficient, such as fluid. Beyond this fluid collection, the structures appear hyperechoic in comparison to other structures. As the ultrasound beam encounters an area beyond a low attenuation medium, there is augmentation of the returning signal that appears brighter. In the images below, we see enhancement caused by the pleural effusion and the internal jugular vein. We should not be able to see the intrathoracic spine when examining the lung. When we see it, it's because there is fluid causing enhancement of the ultrasound beam and thus implies there is a pleural effusion. Refraction artifacts. Refraction artifacts occur when the ultrasound beam is bent from its original direction as it passes through a boundary between tissues having different sound speeds. The following are examples of refraction artifacts. A needle acts as a strong reflector that bends the ultrasound beam. In clip 2, we can appreciate the side lobe artifact. This is due to ultrasound side lobes reflecting a strong reflector outside of the central beam. The side lobe beams are secondary beams as crystals also expand and contract radially. Side lobe beams are low intensity beams that surround a central beam. Wow, that's it. We're done with physics. Off to the next one.